everybody, it's me, Dr. Whimsy, and today we are talking about exhaustion, which is a common problem that I see in my office, and I was asked to talk a little bit about it. Why are people so exhausted, and what can we do from a naturopathic perspective to help heal exhaustion? A lot of people have also talked to me about the subject of adrenal fatigue or adrenal exhaustion. Is the condition known as adrenal fatigue real, or is it a fake disease? It is true that you can do hormonal testing on patients who are exhausted that come into my office, and we can do what's called a 24-hour cortisol test. That lets me know if the cortisol levels are suboptimal, and I sometimes see that in my exhausted patients. At the same time, I would be remiss if I didn't mention the fact that it's debatable whether or not the actual condition of adrenal fatigue is a real phenomenon. But I will say that even though it's not a professional way to say it, being burned out, exhausted, tired is definitely a real problem with my patients. If a patient comes to see me and they say that they're exhausted, I need to find out why they're exhausted. And I'm going to talk a little bit about some of the reasons why you might be exhausted and what you might be able to do about it. The most common reason why people are exhausted is the most obvious: lack of sleep. People are simply not getting good sleep, adequate sleep. If you find yourself in that situation, you might want to make sure you're getting to bed a little bit earlier than you have been. One of the reasons why my patients are not able to get to sleep early is because they want to stay up, play on the computer, play with their video games. They might be talking to people on Facebook, watching movies, TV, etc. There's simply so much stimulation, so many things to do, that they're not getting any sleep. So the first thing you want to rule out when you're looking at an exhausted patient is lack of sleep. If that doesn't answer the question, then you have to talk about issues like insomnia. Is the patient able to fall asleep? Is the person able to stay asleep? You may want to order what's called a sleep study to find out what the quality of their sleep is like. Very important. Let's first make sure you're sleeping well, you're sleeping through the night. If you're not, let's try and find out why. Other issues that might be going on could be an actual underlying medical condition. For example, in women who are of perimenopausal, menopausal ages, we sometimes see sleep disturbances because they're having hot flashes, night sweats, and that can cause a person to wake up repeatedly through the night. In men, it can sometimes be an enlarged prostate, can cause frequent urination. They're not able to void completely, and that can cause a person to get up through the night and not have restful sleep. If you're someone who's addicted to coffee or alcohol, that can disturb sleep. Coffee is a stimulant, and so you want to make sure that your last cup of coffee is about 8 hours before you go to bed, so that your body adequately metabolizes the caffeine to make sure you get a good night's sleep. Same with alcohol. Alcohol may allow a person to get to sleep quickly, but unfortunately it might not be the best quality sleep. Other things that can affect sleep can be stress, agitation, not being able to quiet the mind. There is one naturopathic remedy that I can give you today if you're having problems with stress and anxiety. In addition to looking at breathing techniques and meditation techniques, which I will link below, that may very well help with stress, there's one Bach flower remedy that I do use that I like. It's definitely alternative medicine, but I have found it to be effective in some of my patients, and that is white chestnut. White chestnut is the Bach flower remedy that we prescribe for people who have repetitive thoughts, particularly if they're repetitive thoughts that are keeping you up at night. If none of those are the reasons why you're feeling exhausted, we want to rule out conditions like possible anemia. If you are someone who has had a history of anemia, if you don't make adequate red blood cells, that means you may not be getting adequate oxygen to your cells, and that can lead to exhaustion. So we want to rule out anemia. That can be ruled out with just basic lab work, what we call a CBC. Another reason why you might be experiencing exhaustion can be thyroid dysregulation or hypothyroidism, excuse me. And so if that is what's going on, again, we can usually find out with a thyroid panel. If you have a past medical history of hypothyroidism, then in addition to naturopathic treatments for hypothyroidism, you may be prescribed a medication like Armour Thyroid to help support a thyroid function. And last thing I want to talk about is viruses. Sometimes people can have a infection and not know it. Sometimes a person can have a low-grade fever or a virus. They're not feeling well, and that can sometimes come up in a lab as well. We'll see changes in the blood count that's indicative of them, the person having a flu or whatnot. If a person has a past history of having mono, they may test positive for Epstein-Barr, and that's a chronic fatigue we see post-viral infection. Usually in situations like that, we want to support the patient's immune system as best we can, and also we can give adaptogenic herbs. Some of the herbs that I think work really well for women is rhodiola, is a plant that I prescribe a lot to women to help with balancing women's hormones and with energy. Sometimes some of the different types of ginseng, Lepanix ginseng, can help with mental focus and with exhaustion. The erythrococcus is also used a lot with athletes, and it's often paired with cordyceps, which is a type of mushroom that's been researched in Asia for helping to increase oxygen to the brain. And there's been some interesting cognition studies on cordyceps. Okay, that's just a general intro to some of the reasons why you might be exhausted, along with some general information about some of the treatments that we go to when we're dealing with the condition of a patient being exhausted. If you'd like to find out more about my work, you can go to drwhimsy.com. I'll link it below. And if you'd like to schedule a telemedicine general wellness appointment, you can do that by clicking on the Book Now button that's available on my website. To find out more about naturopathic doctors and our training, you can go to the American Association of Naturopathic Physicians to find a physician who's trained in your area. Thanks a lot for watching, and I hope to speak to you again soon. Bye-bye.